In the last 6 months, we've been doing a pilot of the dialysis program of the NHIA. We started in June when children below the ages of 18 and adults above the ages of 60 were given 8 sections of dialysis for free. In between, 19 to 59 were given 2 sessions for free. We had an allocation from Parliament, which was 2 million Ghana cedis. We looked at our corporate social responsibility budget and we added another 2.2 million. So the total amount that we used for the pilot was 4.2 million. And let me say that the initial submission, the initial list submitted by the Dialysis Association to us were around 700. But the numbers, the actual numbers when we did the pilot came to about 400. So what this means is that we use the 700 in our projection, but the 400 is what is the actual. So what this means that we still have some monies left. Now, what did we do? Why do we know that the NHIA is able to take on this dialysis program from 1st of December? So we use the prevalence rates of patients suffering with dialysis in the country. We got 2 research papers. One put it at 24 patients per million population. The other put it at 38.8, which is 39 per million population. So it's a simple calculation. So if 33.3, if 24 patients is to a million population, then what is 33 million population? So it's just multiplication, and you will get about 804. So it's 33.5 by the 24 patients. So that's the minimum. Then we look at the maximum. The maximum was 39. So it's the 39 times the 33.5 million population. And you get about 1,299. So they're within the range of 1,200. So we now looked at our actual, as in the 400. So the 400, Parliament has also approved 491 for the dialysis sessions as per session. So what we did was we took the 400 as in the 400 as our actual. We just multiplied that by the 491, and we multiplied it by the 8 sessions, which is 2 sessions per week. So per month. So we looked at 800. We doubled the number. So 800. We only multiplied it by the fee that has been approved, which is the 491, by the 8 sections. You get about 3.2 million. Then you multiply the 3.2 million by 12. You get about 39.6, which is rounded up to about 40 million. So that's the second scenario. Then we looked at the third scenario, which is, what about if you open it up and 3 times the number, obviously, visit facilities? So 1,200 by the 491 by the 8 gives you about 4.7 million per month. If you multiply that by 12, you get about 56.4 million. So what this means is that we rounded that up to about 57 million. So annually, the NHIA will spend between 20 to 57 million to cover the 1,002 patients based on the prevalence who are on dialysis. So, as I've given you, obviously, the mathematics of it, you know, the 800 actually corresponds with, the 800 prevalence corresponds with our second modeling, and the 1,002 also corresponds with our end stage modeling, which is the final modeling. So The number of patients by our modeling on dialysis in the country will not be more than the 1,200, which is the maximum, and will not be lower than the 400, as we have indicated. What this means is that the NHIA is able to take on the cost. Now, where do we get the money to pay for these dialysis sessions? First, I've already told you that we do have about 2.2 million left over from our pilots. Our budget for 2025, as projected, is supposed to be about 8.1 billion. Normally, half of that budget goes into claims. So we will do some internal rearrangements. We will look within to see whether to reduce our administrative costs to fund it. It wouldn't be any problem, because at the end of the day, our current budget is about 6.8 billion. So to take 56 out and pay for it is something that we can do. So we also looked at the fact that the manifestos of both parties are uncapping the NHIA. At the moment, we are capped at about 20%. So again, it's simple mathematics. 20 over 100 times our current budget, which is 6.8 billion. That gives you about 1.3 billion extra funds coming in. And I'm stressing that 1.3 billion extra funds coming in. And if you look at the maximum, which is 57 out of the 1.3 billion, it's actually insignificant. Now, our current budget, even if we are not uncapped, because taxes are overperforming, it's expected to be about 8-point-something billion. And we will cover this under our benefit package. So there shouldn't be any problem. The next leg is, what support can the NHIA and the Ministry of Health give to these facilities in such a way that they are able to provide this service or these services? So in collaboration with World Bank, the ministry and the NHIA are procuring some dialysis equipment. Currently, we ordered 30 of these equipment. 7 has been delivered. 23 of these equipment are to be cleared from the port. It's currently at the port. 15 additional ones have also been approved by the PPA just last Thursday. So we've set that into motion. We put it into procurement. But the good news is each 15 of these machines comes with about 2,000 consumables. So it means that with the 45 machines, we have 6,000 set of consumables.